I was injured at work. I'm a physician assistant and I was in the operating room, and the nurse accidentally pushed a hospital bed into my back that sort of hyperextended my back and slammed me under a table. And I ended up with a severe back injury and spinal cord injury. Had surgery, had a lot of complications afterwards with infection and multitude of problems. But when it was all said and done, about 6 months of in and out of the hospital, I had spasticity, involved my left leg. It progressed to the point that I had 30 degrees of flexion contracture in my hip and my knee and my ankle, and walked on my toes. I never could get my heels down to the ground. Walking was very painful for me. Walking more than probably 50 feet, I would start having more and more pain and more spasticity. So I walked with 2 canes when I did walk, but if I had to do anything very extensive, I used a motorized cart, a scooter, to get around, and spent a lot of time more or less just laying in bed, curled up in a ball, because that was the only way I could get comfortable. So it was not living, pretty much, is what one doctor told me. You're not really living the way you are. And he suggested that maybe there was something better for me. So I tried oral Baclofen to help deal with my contractures and all the spasticity, and it helped a little bit, but the improvement was not very significant at all. And we kept pushing the dose higher and higher, and basically it was just making me more sleepy without much benefit. I remember the doctor explaining to me about the intrathecal Baclofen pump and how it could benefit me, but he also said, you know, there were some chances of some complications, like the catheter could kink or the pump could malfunction, you could develop an infection. But for me, the chance of it maybe helping me was far outweighed my concern about the risks, and I was very much anxious to try it.
Michele knew she had to find another solution. She worked with her doctor to see if Itb Therapy, also known as the Baclofen Pump, might be right for her. A Baclofen pump delivers a precise amount of liquid Baclofen through a thin tube, or catheter, to the fluid flowing around the spinal cord, called the intrathecal space. A surgeon places the programmable pump just under the skin of the abdomen. Treatment with the Baclofen pump is for certain individuals with severe spasticity due to cerebral palsy, multiple sclerosis, stroke, spinal cord injury, or brain injury. When spasticity is due to multiple sclerosis or spinal cord injury, oral Baclofen must not control spasticity adequately or have intolerable side effects. A Baclofen pump may be an option for certain people with traumatic brain injury at least 1 year after the trauma.
Before you have the Baclofen pump implanted surgically, they have you come in as an outpatient and do just a one-time injection of the Baclofen medicine into the spinal fluid to see if the intrathecal route is going to be beneficial to the patient. And so when I had the trial, within minutes I could tell that I was getting some significant improvement with the intrathecal Baclofen. So then during the trial, they had a physical therapist come and assess my spasticity like every 15 or 30 minutes throughout the course of the time that the medicine was active. And then it wears off and you're back to the way you were before. But for that short time when the intrathecal Baclofen was working during the trial, I was just elated. And then I knew that this was going to really be something that could help me. It was a wonderful day. And I had worked it up to such a huge thing that I don't know what I would have done if it wasn't a positive test.
Possible temporary side effects of the screening test include loose muscles, sleepiness, upset stomach, vomiting, headaches, and dizziness. Be sure to tell your doctor if you experience any of these side effects. You should not have the screening test if you have an active infection or if you are allergic to Baclofen. After the screening test, you meet with your doctor to discuss the test results and determine whether you are a candidate for a Baclofen pump. Michele did not experience complications or side effects of screening or the therapy, but some people experience surgical complications, side effects of the drug, or both. The risks associated with implantation of the pump include spinal fluid leak, infection, and headache. Drug-related side effects may include loose muscles, drowsiness, nausea, vomiting, headaches, and dizziness. Some patients may need to return to the clinic to have a repeat screening test at higher doses to determine if they may be a candidate for ITB therapy.
I did have some concerns about having the intrathecal Baclofen pump, even though I knew I was going to proceed with it. I had read so much online and all the materials, and I really studied up quite a bit, and I knew that there were significant risks, but I still wanted to proceed with it, so I did.
Although Michele saw dramatic differences, the same results might not happen for everyone. It is important to consult your doctor to discuss if the treatment might be right for you. Once a Baclofen pump is implanted, it is important to follow your doctor's instruction closely because a sudden stop of intrathecal Baclofen therapy can result in serious Baclofen withdrawal symptoms such as high fever, changed mental status, muscle stiffness, and in rare cases may result in loss of function of many vital organs and death. Pump and catheter complications can result in overdose or underdose of Baclofen and may require surgery to correct. Patients and caregivers must be able to keep scheduled refill visits so you don't run out of medication and to know the early symptoms of Baclofen withdrawal. ITB therapy is not for every type of spasticity, and results vary from person to person, but it may help some people with severe spasticity live more comfortably and make everyday activities easier. With looser muscles, those receiving ITB therapy may move more freely, experience less spasticity-related pain, and feel less limited in their abilities. Get to know this option, then consult with your doctor to see if it may be right for you.